Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. My name is David Wyant, Chair of the Alberta Health Services Board, and I'd like to welcome everyone here today to 7th Street Plaza, as well as those watching across the province through Facebook Live. I'd like to acknowledge that we are gathered today on Treaty 6 Métis and Métis Region 4 territory, the traditional meeting place and home of many Indigenous peoples. As you may have noticed, there are a few new faces around this table, including my own, since the previous board meeting. I was honored when the minister asked if I would take on this role as chair of the board, and pleased to return here to Alberta Health Services, where I had started as a legal consultant some 20 years ago, and where I had worked for some time, ultimately serving as a senior executive until 2013. So, new face, but returning face here. I would like to thank Linda Hughes, who is not here today, who provided leadership for this board for the past 3.5 years, for her dedication and her leadership in improving the our efforts towards better patient outcomes, patient experiences, and health system financial stability. I'd also like to introduce 3 other new board members who bring to AHS unique skill sets and perspectives. Not present today, but newly appointed to our board is Stephen Mandel, who many of you will know from his previous service as Alberta's Health Minister, the Mayor of Edmonton, and the leader of the Alberta Party. Present today, Brian Vazjo brings to AHS board more than 35 years of experience, corporate experience in the energy sector, and also as past chairman of the board of the United Way here in Edmonton, and past chairman of the board of Stars Air Ambulance. Heidi Overgaard, thanks, sorry. Heidi. Heidi Overgaard comes to us from Central Alberta, where she is a passionate advocate for rural health care. As a former chair of the Sundre Health Professional Attraction and Retention Committee, and former vice chair of Sundre Hospital Futures Committee. Heidi is also a small business owner and brings that perspective to us. I look forward to working with all of the members of the board, as well as senior executive and leaders, in order to continue to pursue our shared goal of improving patient outcomes and experiences and finding efficiencies throughout the system. As Canada's biggest province-wide healthcare system, we need to remain responsive to our communities across Alberta by providing programs and services that address their healthcare needs. Authentic community engagement must remain an integral part of our work here at AHS. And that's why later this month, I'm pleased that I will be joining more than 140 members of our health advisory councils, provincial advisory councils, and wisdom council for the 2019 Fall Forum. Advisory councils, as you probably know, give Albertans the opportunity to be involved in their health system by providing input on strategic and capital planning, as well as development of programs, services, and policies. The Fall Forum is an opportunity for council members to meet with AHS leaders, to discuss healthcare issues that matter to their communities, and to help give Albertans a direct and tangible voice in AHS decision-making. I look forward to being there and to meeting our advisory council members. AHS has bolstered community engagement efforts in recent years, thanks to the leadership of our Vice Chair, Dr. Brenda Himmelgarn, who also chairs the Community Engagement Committee of the Board. Community engagement is a priority for Brenda, and she has made it a priority for our entire organization. So thank you, Brenda, for your work, and I'd also like to congratulate you on your new role as Dean of the Faculty of Medicine and Dentistry at the University of Alberta. Congratulations. Finally, I have one last important item to note. This is my public service announcement. I'd like to remind all of you that AHS will soon be launching its annual influenza immunization campaign. Influenza immunization is actually already available. It's now available free of charge to all Albertans who are 6 months of age and older. And I'm pleased to say, as a note of leading by example, one of our board members has already attended and obtained their immunization, and others of us are planning to do so tonight. So I encourage you to take advantage of the program and get immunized before influenza arrives. And it typically arrives in Alberta every fall and takes a serious toll on our communities. Immunization is our best opportunity to prevent this. Please schedule a visit to an AHS immunization clinic or ask your local pharmacist or family doctor about influenza immunization. You can find clinic information on our website, ahs.ca, or by calling HealthLink at 811. So I'll soon pass the microphone, figuratively speaking, over to our President and CEO, Dr. Verna Yu, who has some comments about AHS's efforts to provide more in community care, in many cases, inside patients' homes. But before I do that, we have a couple of business matters. So do all of the board members have the agenda? Can I ask that someone move approval of the agenda? Thank you. And second? Thank you. All in favor? Great, carried. Declarations of conflict of interest. Does anyone have a conflict of interest that you'd like to declare based on the agenda before us today? Thank you. Seeing none, we'll move on. The minutes for the last meeting have been presented to each of you. Does anyone have any questions or concerns about the minutes? Great. May I have someone approve? Great, thank you. And seconded. Thank you, Brenda. I think without further ado, Verna, please.
Thanks, David, and welcome as the new board chair for Alberta Health Services, and really representing myself and management for Alberta Health Services and our organization. We also would like to thank Linda Hughes and her leadership as our past board chair. And to Stephen and Brian and Heidi, welcome aboard. We look forward to working with you and really achieving our 4 main goals within the organization, which is about improving patient and family experiences, improving patient and population health outcomes, improving the safety and experience of our people, and improving financial health and value for money. So one way that we're addressing these 4 goals simultaneously is by providing more care in the community, something we call enhancing care in the community. We know, for instance, that hospital-based care is not always the best place to be in when you don't need to be. And to top it off, it's the most expensive form of care when it comes to cost. We also know that there are people in our hospitals who could receive the same level of safe, high-quality care in the community or even in their home. When we identify these patients and give them the opportunity to move their care closer to home or in their home, we end up improving patient outcomes and experiences at a reduced cost to the healthcare system. Healthcare providers like it too, because it requires collaboration between many teams and disciplines. Here in Edmonton, the virtual hospital program works with patients in their homes to keep them healthy and prevent repeated readmissions to hospitals. I'd like to show you a video that profiles a local family using virtual hospital services and highlights how these services are making a difference in the lives of the patient, her husband, and her children. Please take a look.
Hard workers. Mom or dad have never been slack. And I think that's been something that's caused Mom a lot of grief through getting sick, was her inability to do, because she's always been a doer.
It's my nerves and my muscles, and when they meet, they short out.
She had trouble swallowing. She couldn't walk very well.
And it got so my eye would droop so bad you could hardly see.
It was hard on her, not knowing what's happening with your body and trying to get all that figured out.
I have spent a lot of time in the hospital.
over the 5 years, I don't know, 7-8 times probably in the hospital, and typically a couple of months, could be a couple of weeks to a couple of months time within the hospital.
I was there every day actually for the 3+ months he was in the hospital. I'd be at the hospital by about 3:30 or 4 and stay there till around 8 or 9ish. The most difficult part was coming home to an empty house.
She just said they check up on your mom, and it's kind of like having a mini hospital away from the hospital. And I thought, oh my goodness, yes, please. I would love that. That sounds amazing.
One of the great advantages of the virtual hospital, and the fact that you've got day-to-day communication with patients, is that you have the opportunity for patients to contact and reach out directly to the team. And if something's starting to go wrong, we have the opportunity to reach out directly to patients by getting a community paramedic in to assess them.
With Mom coming home, it's Leon and I and Dad trying to get in touch with other physicians, those kinds of things, to resolve these issues. With the virtual hospital, they were on the phone every morning kind of thing to resolve or talk about any things that were happening and make very quick decisions.
One phone call, not searching for 20.
Yeah. Well, and not searching and not waiting, for calls back and those kinds of things.
Having answers and just feeling that security, yeah.
The virtual hospital has been phenomenal, just like family.
I know that took a lot of pressure off my dad, which meant that it gave them more of a secure feeling at home.
Peace of mind, seriously, over the last while has been literally to the point where, been able to just settle down.
When you go to the hospital, there's always lots of waiting and stuff. But at home, they come and they just do it. Since I've been part of this program, I haven't been to the hospital at all.
You're providing hospital-level care to patients in the context of their own home.
And it was comforting to us to know that somebody was watching out for us. That we weren't just out here all alone. To me, that meant lots.
Together, we do amazing things every day.
So Virtual Hospital started admitting patients about 16 months ago, and as of last week, was providing care to about 100 patients. Stories like Clara's tells us that we're on the right track and doing the right thing for Alberta patients and families by providing more care in the community. Before I hand the mic back to David, I'd just like to close by congratulating our EMS team for winning the Fixed Wing Award of Excellence, given out annually by the Association of Air Medical Services. It's an international, nonprofit association with a focus on quality, safety, and effective medical care in the air medical and critical care ground transport industry. AHS EMS oversees the operations of 11 King Air aircraft based in 10 communities across the province, and each year, Air Medical Services transports more than 7,000 patients. The Fixed Wing Award of Excellence recognizes leadership in resource and patient coordination, clinical care, and outstanding aviation safety. So congratulations to our EMS team, and thank you for always striving for excellence on behalf of the people that we serve. So thank you very much for listening today, and as David said, please go out and protect yourself and your families by getting the immunization. So over to you, David.
Thank you, Verna. And I will turn it over to Marlis Taylor, who is the chair of our Human Resources Committee.
Thank you, Mr. Chair. Human Resources Committee met on September 11th. The committee received a standing quarterly report on our people results and a labor relations update. The committee also discussed the status of our people survey. This is a periodic survey that is carried out to measure the engagement of AHS staff, physicians, midwives, and volunteers. The committee also discussed the implications of the organization of Bill 2, an act to make Alberta open for business, as it introduces some changes to the Employment Standards Act and the Labor Relations Code Finally, the committee received a report on the very successful implementation of the status of the PeopleSoft program upgrade. There were no items that came through this committee for board approval.
Thank you. Our next report will be from Quality and Safety Committee, delivered by Glenda Yates.
Thank you, Mr. Chair. The Quality and Safety Committee met on September 11th of this year. The committee's meetings focus on the three-pronged areas of access, quality, and safety. The committee received a report on addiction and mental health initiatives and access. They also received a report on the Provincial Breast Health Initiative experience. The committee commended management on the work of this team and noted the success of the scalability and discussed the importance of communication and education in this area. The committee received updates on the medical staff bylaws and the midwifery services bylaws, quarterly patient safety report, and a presentation on a comparative analysis of Alberta data and Canadian Institute for Health Information, or CIHI, data. The committee reviewed the Infection Prevention and Control Annual Report, which provides an overview of the outcomes achieved in partnership with programs across the province, including accountability and monitoring, province-wide surveillance, human resource capacity, physical environment and infrastructure, and public awareness and education. The committee recommended that the board approve the report. The board also reviewed the report and the committee recommendation at today's meeting. Accordingly, I move that the Alberta Health Services Board approve the 2018-19 Infection Prevention and Control Annual Report for submission to Alberta Health. I so move, Mr. Chair.
Thank you. May I have a second? Thank you. All in favor? Motion carried. Thank you. I should add that Glenda gave that in her capacity. When I introduced her, I didn't say she was the chair of the committee. She is also going to present the report from the Finance Committee, where she serves as vice chair because our chair, David Carpenter, is not with us today. Please.
Thank you, David. The Finance Committee met jointly with the Audit and Risk Committee on August the 7th, 2019, and also it met on September 12th, 2019. The committee considered a number of items for recommendation for approval to the board. First, the first quarter investment report. As mandated by the AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. The Regional Health Authority's regulation and the AHS investment bylaw describe the requirements of the board to approve or ratify by resolution AHS's investment decisions. The committee was presented the 2019-20 first quarter investment report and recommended that the board ratify the transactions. The board reviewed this recommendation. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions as described below and as certified by signed investment compliance certificates from AHS and Phillips Hager and North Investment Management. A, as at June 30th, 2019, Alberta Health Services held restricted and unrestricted funds managed by Phillips Hager and North Investment Management and Manulife Financial, totaling $1.31 billion. B, the funds were invested in short-term treasury bills, federal and provincial and corporate fixed income bonds, pooled mortgage funds, bond funds, and Canadian and global equity funds. And C, all of the funds invested during the quarter ending June 30th, 2019, were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager and North Investment Management. I so move.
Thank you. May I have a seconder? Thank you, Hugh. All in favor? Carried. Thank you.
Second, the committee reviewed proposed amendments to the AHS banking resolution to reflect changes in management titles. The committee recommended the board approve the revised banking resolution. The board reviewed the recommendation. The titles will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the amended banking resolution in the form reviewed by the Finance Committee and the board. with such non-substantive changes that management of AHS considers necessary or advisable. I so move.
Thank you. Second, oh, you're on top of it. Thank you, Marlis. All in favor? Carried. Thank you.
Thirdly, the committee considered proposed amendments to the Master Services Agreement between AHS and Chartwell Master Care LP. The total combined commitment value is greater than $90 million multi-year after amendments. Accordingly, the board approval of the amendments and delegation of signing authority to the President and CEO is required in accordance with policy number 1100, delegation of authority and establishment of controls for commitments. Accordingly, I move that the Alberta Health Services Board approve the proposed amendments to the Chartwell Master Care LP Master Services Agreement as reviewed by the Finance Committee and the Board, with such non-substantive changes that management of AHS considers necessary or advisable, and delegate signing authority of such amendments to the AHS President and Chief Executive Officer. I so move.
Thank you. All in favor? Carried. Thank you.
In addition to those items considered by the committee, I've been asked to speak to 4 contract approvals that the board reviewed. All 4 items require the board's approval and delegation of signing authority to the AHS President and CEO in accordance with AHS policy number 1100, delegation of authority and establishment of controls for commitments. First are the radiology contracts with Calgary and Edmonton. The AHS board has reviewed the substantive terms and conditions for the new radiologist contracts with Calgary and Edmonton radiology groups. The radiologists ratified the terms of the contracts on September 5th, 2019. The board supports the ratification of the contracts. Accordingly, I move that the Alberta Health Services Board approve each of the radiologist contracts for Calgary and Edmonton on the terms and conditions reviewed by the board, with non-substantive changes that management considers necessary or advisable, and delegate signing authority of such contracts to the AHS President and Chief Executive Officer. I so move.
Thank you. Second. Thank you. All in favor? Carried.
Second is the Cancer Control Alberta Physician Agreement. A request from the Alberta Medical Association on behalf of the Cancer Control Alberta physicians has been made to AHS to approve an agreement effective October 1st, 2019. The board reviewed the substantive terms and conditions of the agreement and supports the approval. Accordingly, I move that the Alberta Health Services Board approve the Cancer Control Alberta Physician Agreement effective October 1st, 2019, on the terms and conditions reviewed by the board, with non-substantive changes that management considers necessary or advisable, and delegate the signing authority of such agreement to the AHS President and Chief Executive Officer. I so move.
Thank you. Second. Thank you, Brian. All in favor? Carried. Thank you.
Third is a 1-year extension of the current linen contract with K-Bro Linen Systems for the Calgary zone. The board reviewed the terms and conditions of the extension and supports the approval of the extension. Accordingly, I move that the Alberta Health Services Board approve the 1-year extension effective February 29th, 2020, to the current contract with K-Bro Linen Systems for the Calgary zone, and delegate signing authority to the AHS President and Chief Executive Officer. I so move.
Thank you. Second. All in favor? Thanks.
The final item is an extension of the acute housekeeping contract with Sodexo for Calgary and South Zones. The board reviewed the terms and conditions of the extension and supports the approval of the extension. Accordingly, I move that the Alberta Health Services Board approve the 1-year extension to the current contract with Sodexo Canada Limited for the Calgary and South Zones, the extension to be effective April 1st, 2020, and delegate signing authority to the AHS President and Chief Executive Officer. I so move.
Thank you. Second. All in favor? Carried.
And Mr. Chair, that's the end of my report.
Thank you. Yes. Thank you for getting us through all of those motions. Much appreciated. Our next item is a report from the chair of our Audit and Risk Committee, Hugh Somerville.
And while I may wish to usurp the title, Mr. Carpenter is the chair, but
my
he was unable
apologies.
to be personally present, so I'll read the report on his behalf. Thank you, Mr. Chairman. As mentioned under the Finance Committee report, the Audit and Risk Committee met jointly with the Finance Committee on August 7th. The Audit and Risk Committee also met on September 12th. Standard practice is that the Office of the Auditor General and KPMG are guests at the meeting in their role as external auditors of AHS, and they attended for both meetings. The committee received the Auditor General's report, Connect Care Audit Plan, and the OAG, the Office of the Auditor General, spoke to the audit criteria, the audit approach, and focus and status of the audit. They also spoke to the strong collaboration between the Office of the Auditor General and the AHS internal audit team. The committee also received a quarterly enterprise risk management report, a status update on outstanding audit recommendations, and the internal audit and enterprise risk management quarterly performance report, which provides an outline of the portfolio's progress. The committee also received the Legal and Privacy Annual Report. There were no items that came through the committee for board approval. That ends the report. Thank you.
Thank you. Our next item is our Community Engagement Committee report delivered by, and I know Brenda is the chair, by Dr. Brenda Hemmelgarn.
Thank you, Mr. Chair. The Community Engagement Committee met on both September 13th as well as October 7th, 2019. The Executive Director of the Grand Prairie Regional Hospital Foundation and a member of the Wisdom Council attended the meeting on September 13th. The committee considered 2 items for recommendations for approval of the board with respect to appointments of trustees to foundations, as well as appointments and renewals of members to advisory councils, and the appointment of the chair for the Cancer Provincial Advisory Council. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare in the province. Given the number of appointments and renewals, the names will not be read in this meeting, but they will be incorporated into the minutes of the meeting and posted publicly. The responsibility to appoint trustees to established foundation also lies with the AHS board. The committee recommended the board approve trustee appointments as reviewed by the committee, and the board considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations for the terms reviewed by the committees and the Alberta Health Services Board. I so move.
Thank you, Brenda. Seconder? Thank you. All in favor? Motion carried. Thank you.
The committee also considered appointments and renewals to advisory councils and the appointment of the chair for the Cancer Provincial Advisory Council. The responsibility to appoint or renew council members lies with the AHS board. The committee recommended the board approve the member appointments and renewals as reviewed by the committee. The board has considered such recommendation. Accordingly, I move that the Alberta Health Services Board approve the appointments and renewals of members to the advisory councils and the appointment of the chair for the Cancer Provincial Advisory Council for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Second, all in favor? Motion carried. Thank you. Thank you, Brenda, for that report. And I want to end our meeting just by echoing Brenda's comments about our gratitude for the volunteers across the province who help us deliver on our mandate. So thank you to all of those people who have been appointed and to those people who have served in the past and who are looking forward to serving in the future. We are adjourned.
Together, we do amazing things every day.